All right, we are here with Dr. Norm Shealy, neurosurgeon. Dr. Shealy, what about people that are bipolar? I don't think I'm bipolar, but I definitely have ups and downs. Maybe bipolar 3. But what do we do about bipolar?
Well, bipolar is people who go from deep depression to manic hyperactive behavior. If I can get them in the manic stage, I can give them 4 grams of magnesium chloride slowly, intravenously, and I have brought people out of the manic phase just to do that. All people with bipolar are deficient in several things. Number 1, magnesium. Now, magnesium is very poorly absorbed in the gut. It is interfered with, if you will, if you have calcium at the same time, if you have high protein at the same time, if you have fat at the same time. Furthermore, magnesium is better absorbed through the skin than it is through the gut. So actually 80% or more of all the diseases we're talking about are deficient in magnesium.
Really?
So
Why?
Because our soil is deficient. There's 10,000 years of farming and erosion after glaciation. And cattle farmers know if they don't give their cattle magnesium supplements, they die.
The
grass staggers. So every known disease essentially is associated with low levels of intracellular magnesium. And I found 20 plus years ago it's far better and safer absorbed through the skin than it is through the mouth. But in a crisis situation, I can give it intravenously and take care of the manic phase, especially of bipolar disease. Now, of course, they need all the things we usually use for depression and anxiety as well, because the manic phase is the height of anxiety, and the depression phase is the height of pre-suicide, and so they need to use a cranial stimulator. They need to have taurine, which works with magnesium to lower the electrical charge inside your cells so it's normal, etc. And so the treatment that we use for magnesium for depression and anxiety is essential, along with getting them under control chemically.
Will that prevent them, on that protocol, will that prevent them from going up and down, or just when they're up and down, it'll help them?
No, if they do it initially and I get them stabilized, and it can take a week sometimes, then if they continue using the lithium, orotate, the taurine, the tryptophan if they need it, that kind of thing, and the cranial stimulator, it'll keep them long term.
Really? So they won't have bipolar, or they will just have a much less?
They just won't have the extreme bounces, yes.
Really? Wow, that's really interesting.